I have end-stage renal disease. You can get Medicare no matter how old you are if all of these apply. Your kidneys no longer work, you need regular dialysis or have had a kidney transplant. One of these applies to you. You've worked the required amount of time under Social Security, the Railroad Retirement Board, or as a government employee. You're already getting or are eligible for Social Security or Railroad retirement benefits. You're the spouse or dependent child of a person who meets either of the requirements listed above. Contact Social Security for more information about the amount of time required to be eligible for Medicare. If you get benefits from the Railroad Retirement Board, call 1-877-772-5772. If you're eligible for Medicare because of ESRD and you qualify for Part A, you can also get Part B. Signing up for Medicare is your choice, but you'll need both Part A and Part B to get the full benefits available under Medicare to cover certain dialysis and kidney transplant services. You can sign up for Part A and Part B by visiting your local Social Security office or by contacting Social Security. Important: if you apply for Medicare and are approved because of ESRD, you can sign up for Part B without paying a late enrollment penalty, even if a penalty would normally apply. Also, if you currently have Medicare based on age or disability and you pay a Part B late enrollment penalty, the penalty will stop when you become eligible for Medicare based on ESRD. Eligibility for Medicare coverage based on ESRD works differently than other types of Medicare eligibility. If you're eligible for Medicare based on ESRD and don't sign up right away, your coverage could start up to 12 months before the month you apply. Example: if you become eligible for Medicare based on ESRD in February, but don't sign up for Medicare until November, your Medicare coverage will start in February. This is called retroactive coverage. If you're on dialysis, Medicare coverage usually starts on the first day of the 4th month of your dialysis treatments. This 4-month waiting period will start even if you haven't signed up for Medicare. Example: if you start dialysis on July 1st, your coverage will begin on October 1st, even if you don't sign up for Medicare until December 1st. If you're covered by an employer group health plan, your Medicare coverage will start the 4th month of dialysis treatments. Your group health plan may pay the first 3 months of dialysis. Medicare coverage can begin as early as the 1st month of a regular course of dialysis treatments if you meet all of these conditions. You participate in a home dialysis training program offered by a Medicare-certified training facility during the first 3 months of your regular course of dialysis. Your doctor expects you to finish training and be able to do your own dialysis treatments at home. You maintain a regular course of dialysis throughout the waiting period that would otherwise apply. Important: Medicare won't cover surgery or other services needed to prepare for dialysis, like surgery for a blood access, fistula, before Medicare begins. However, if you complete home dialysis training, your Medicare coverage will start the month you begin regular dialysis, and these services could be covered. If you're already getting Medicare due to age or disability, Medicare will cover physician-ordered fistula placement or other preparatory services before dialysis begins. People with ESRD can choose either Original Medicare or a Medicare Advantage plan when deciding how to get Medicare coverage. Medicare Advantage plans are a type of Medicare health plan offered by a private company that contracts with Medicare to provide all your Part A and Part B benefits. Most Medicare Advantage plans also offer drug coverage. If you join a Medicare Advantage plan with drug coverage, you'll get your drug coverage through your plan, and you can't join a separate drug plan. Some Medicare Advantage plans also offer extra coverage like vision, hearing, and dental coverage. Important: in many cases, you'll need to use healthcare providers who participate in the plan's network and service area. Before you join a plan, you may want to check with your providers and the plan you're considering to make sure the providers you currently see, like your dialysis facility or kidney doctor, or want to see in the future, like a transplant specialist, are in the plan's network. Once you become eligible for Medicare based on ESRD, your first chance to join a Medicare drug plan will be during the 7-month period that begins 3 months before the month you're eligible for Medicare and ends 3 months after the first month you're eligible for Medicare. Your prescription drug coverage will start the same time your Medicare coverage begins, or the first month after you make your request, whichever is later. Medicare Part B covers transplant drugs after a covered transplant, and most of the drugs you get for dialysis. However, Part B doesn't cover prescription drugs for other health conditions you may have, like high blood pressure. Medicare offers prescription drug coverage, Part D, to help you with the costs of your drugs not covered by Part B.